If you're battling an ache or pain, have you ever thought, what if I just ignore it? What's the worst that can happen if I delay treatment? I'm going to answer that in this video. My name is Dr. Garcia. I'm a leading expert in rehabilitation and pain management. And when we look at why people develop pain, why they seek treatment, what happens, what's the worst that can happen? Well, if you're suffering from a current ache or pain, there's a spiral that happens. It might bother you with, maybe you were at the gym, maybe you were running, you were walking, or you twisted your knee, and that is now interfering with your daily life. Maybe getting out of bed, going up and down stairs, or even worse, it started to go into your work life. Maybe you sit for a living and your back is hurting, or you do heavy manual labor, or you do other forms of activities and it's now limiting you. Or even worse, it's now bothering you in the gym. It's bothering your fitness activities. It's bothering you when you are hiking or running or playing pickleball. Now that's a spiral that happens, and it's a progression. And if you are delaying treatment, I'm going to explain how worse it can get and where you can find yourself and when you can start to seek out treatment. Now, pain develops because you inflamed a local area, and that local area is talking to you and saying, hey, maybe you shouldn't bend your knee, you shouldn't raise your arm. And if you leave it alone, or it's not that traumatic, things just go away. And you've felt those before, those aches or pains. You tweak your back and miraculously 2 or 3 days later, or within a week or two, it's gone. That's fantastic. If you're in that first 2-week window and you don't think it's bothering you that much, it's probably not a concern. But anyone after that 2-week mark, maybe you're at 6 weeks, maybe you're at 12 weeks, maybe you're at 6 months, here's what happens. All that inflammation, if you continue pushing past through it, being stubborn, continue to go into the gym and hoping that it goes away, it builds scar tissue and it creates immobility. So you become less mobile, you use it less. Well, as people see this, they either take pain medications or they continue pushing through that, and the body eventually fills with swelling. It tells you not to use it. You become weak. You start thinking about medications. You start thinking about injections, and then you start going down this mental spiral of, well, I need surgery for this. Well, anything longer than 6 weeks becomes chronic pain. And when you have this concept of chronic pain, the pain is localized, but it's also hardwiring to the brain that you need, that this is still in pain and that nothing is going to help it go away, so that you get traumatized. You begin thinking about worst case scenarios. And if you're suffering from an ache or a pain and you thought to yourself, gosh, I wonder if this is going to go away. What happens if I delay treatment? Well, the reality is if you continue to delay treatment, you're going to have scar tissue, you'll have swelling, you have immobility, you won't be able to go to the gym as often, you will become less mobile, you'll lose strength. And when that typically happens, we also see that people become less active. They maybe gain a little bit of weight. They're less motivated. So if you are on a great kick of fitness and health and you've been trying to improve your health, but you're now at this point where you can't do any of that because of your pain, delaying treatment will cause more irritation, more scar tissue formation, more use, and it goes down the spiral towards chronic pain. And we don't want that for you. So if you've been stuck and you're not sure if treatment is for you, anything beyond 2 weeks I would highly recommend, and anyone beyond 6 weeks of pain, you must see somebody about it. Now, I'm not just talking about your primary care physician, because all they're going to do is tell you to rest it, which is the problem you've been on, or take some medication, which is only going to worsen your total experience. So if you're looking for a solution and you're past that 6-week mark, now is the time. Why? Because you'll get weaker, you'll become less active, you will potentially not go to the gym, not enjoy your fitness activities, and this brings a big challenge to your daily life. So if you're looking for a solution to finally get active again, right now is the time for treatment, because you will find yourself potentially gaining weight and thinking that you need surgery, and that's not what you want. That's not what anybody wants. So if you're looking for a holistic, natural solution without medications or injections or even surgeries, my team and I at Sports Performance Physical Therapy would be happy and excited to help you. It all starts with a phone call. contact us. We'll walk you through what you've been through and what treatment and a forecast of what your improvement will be. And that all starts with a phone call. You can contact us at any of the contact information below, and we'll point you in that direction. We'll give you clarity, we'll give you direction and what your future of health entails. So instead of thinking, what if I delay treatment? What's the worst that can happen? Now you have an understanding of what could happen if you fix it now. All you have to do is start with that phone call, and we'll point you in that right direction. We're excited to help you feel better today. Hi, if you found this video helpful, please give it a thumbs up. Don't forget to subscribe and hit the bell notification for my weekly tips on improving your lifelong health without aches and pains. Thanks, and I'll see you soon.